Greetings, ladies and gentlemen. Welcome to the second component of pharmacokinetics, a lecture that covers drug distribution. And after you've done this unit, basically a topic under this unit, you should be able to define what drug distribution is. You should be able also to mention and discuss the parameter that is used to measure or quantify distribution as a process. You should also be able to do some basic calculations on how you can determine volume of distribution. You should also be able to now discuss the factors that influence drug distribution. So let's get into it. Distribution of drugs. Basically, from the first component, we've seen that if a drug is administered, it has to be able to move from its administration site into blood. If it is administered directly into blood, then well and good, we skip the first component. But the second component is that the same way the drug is moving from administration site into blood, it will now begin to move by the same process into the various compartments of fluid other than plasma. And this process is what is called drug distribution, which is a passage of the administered drug from blood, plasma, into the various tissue compartments. And so it is crucial that we understand that because there is a barrier, biological membranes, capillary walls, that needs to be traversed, that needs to be encountered, that becomes an interface. That is a barrier, should be crossed. Therefore, there are several factors that will determine whether the drug will be able to escape or the drug will remain within vascular space. So what is drug distribution? Basically, we are saying this is the passage of the drug through body compartments from plasma. And then we use the volume of distribution to determine how much the drug has moved from blood, how the blood has been lost from plasma, also known as extravascular escape. Extra meaning out or away. In this case, vascular relating to blood vessels. So the extravascular blood drug escape or plasma blood drug loss is basically the movement of the drug from plasma into the various tissue compartments, fluid compartments like interstitial fluid, intracellular fluid, as well as transcellular fluid. So what is volume of distribution? The volume of distribution is the parameter that we use to measure drug distribution, and is defined as the apparent volume that would accommodate all the drugs in the body, considering that the concentration throughout the body was the same as that in plasma. In other words, we are saying when the drug has been absorbed, it's there in plasma. So what is the volume of fluid that will be able to dissolve this drug? Okay. Now, you don't answer the question right there and then. You also consider that this drug, when we consider the concentration, we will also be able to consider the fact that is this drug only in plasma, or it is also dissolved in the other fluids other than plasma. If the answer is that this drug has a volume of distribution where the water that is dissolving it is only the plasma, then it means this drug is only restricted in the plasma and it is not passing, it is not escaping, it is not being lost from blood. Therefore, it has a low volume of distribution. It has a small volume of distribution, and its extravascular escape, it plasma loss is very low. But if we find that the volume of distribution is above the plasma volume, then it means the drug is also dissolving in the rest of the fluid other than the vascular fluid, which is plasma. And in this case, we'll say the drug has a extravascular escape, or it has a high volume of distribution, it has a large volume of distribution, or it has very high distribution in the body. So how do we determine the volume of distribution? It's basically the same formula that we use in chemistry, where we say, how do we calculate the concentration of a substance? Is that you find the mass, then you divide by the concentration that you want to achieve. That is your volume. Okay. If you want to calculate also the dose, the mass, in this case we are saying that the mass in this case is the dose of the drug you're administering, and the concentration is the plasma concentration you want to achieve, or the Cmax. That is your relationship of volume of distribution, the dose, and the plasma concentration. That the volume of distribution is inversely proportional to plasma, meaning if the plasma concentration is small, then it means that the amount is escaping, the drug is escaping the plasma. Therefore, the volume of distribution is large. Okay, so they are inversely related. The volume of distribution is small, then the most of the drug will be concentrated in plasma, so the plasma concentration will be high. But the larger the dose, the more the volume of distribution. The smaller the dose, the smaller the volume of distribution. That's the relationship. So a small volume of distribution, therefore, is favored by the fact that then the drug has low lipophilic ability to be able to cross the capillary walls. Also, it may be highly bound to plasma proteins, so the drug as a huge complex will be able to fail, will not be able to easily cross by diffusion. But also, when the affinity of this drug for tissue constituents or proteins is not high, it will remain in the vascular space without being attracted or lost to tissues. So what is the importance of this parameter we are calling volume of distribution? So if we know the volume of distribution first of all, then we could actually know how much the drug is being lost from plasma. Okay, so volume of distribution, for example, for a drug like furosemide, which is used in reducing the plasma or the blood volume in hypertension or heart failure, indicates that the tissue uptake is limited. So there is very little in tissues, but mostly it is what? In vascular or blood. A large volume of distribution for a drug, for example, for digoxin, that is used in arrhythmias, also to improve the force of contraction of the heart, indicates that the drug is extensively distributed in tissues. So, volume of distribution can be used to estimate the extent of extravascular tissue uptake of the drug. Now, if we know that we've measured the volume of distribution of the drug, or we have estimated the volume of distribution of the drug, then we can actually tell whether this drug can be corrected during toxicity by filtering the blood or by just giving an antidote, and you sort out the problem. So if the volume of distribution is small, then the drug is mostly concentrated in what? In plasma. So if you introduce dialysis connecting the patient to an artificial kidney, it will be able to filter the blood and get rid of the what? Of the drug, and reduce the toxic effects. But if the large volume of distribution is what is exhibited by the drug, then giving dialysis alone becomes problematic. It is irrational, in fact, because the drug is mostly in tissues, and doing dialysis will only remove limited amount of the drug from the body, and so you will not be able to correct toxicities. Volume of distribution, therefore, also is useful because of the relationship between dose, plasma concentration, and volume. volume of distribution can be used to determine the loading dose. What does it mean? If, for example, a patient came in a critical state, maybe because of septicemia, maybe because of meningitis, maybe because of viremia, maybe because of bacteremia, the patient is in a critical state where for example, you need to give a drug, the amount of the drug that will quickly correct or reduce the microorganisms in the body. You may need to start with a larger dose. Of course, it has to be a safe dose. You give a larger dose that will begin to work, and then you begin to give a lower one that we call a maintenance dose. So the initial dose is called the loading dose. How do you determine that? One of the ways is just to use the relationship between volume of distribution and plasma. So if we say volume of distribution is dose divided by plasma, then we can say that the dose needed to start the treatment will be the volume of distribution, which is a profile of the drug, multiplied by the target concentration you want to achieve, and then you get your loading dose. So we are saying, number one, a volume of distribution can be used to estimate extravascular tissue uptake. We can also use volume of distribution as the means to determine whether we can use whatever mechanisms for management of toxicity, and also we can use volume of distribution information to determine the loading dose. What would be the factors that can influence volume of distribution, how much the drug escapes the plasma? One of them is that it's the properties of the drug. For example, lipophilicity, the ability of the drug to dissolve in fat and be able to cross biological membranes. So the more lipophilic, the more it is able to diffuse and leave the blood into other tissues. One of the other parameters is that one of the other factors is that the amount of blood flow and the size of the tissue will determine whether some of the drug will be lost into those tissues or not, because the more the drug is delivered to a particular tissue, the higher the chances of such a drug to be lost into those tissues. The other thing is that the ability of the drug to be bound to plasma proteins can influence also, because if the drug is highly bound to plasma proteins, it becomes a larger molecule and cannot easily diffuse. Therefore, plasma protein binding also influences the size of the VD. The binding of the drug to cell and tissue constituents also influences this. So if the drug has very high affinity for tissue constituents like calcium in the bones, like proteins in the liver, in the hepatocytes, and also cardiomyocytes or heart tissue that attracts certain drugs like digoxin, can influence whether the drug will have a larger volume of distribution or a smaller one. So let's look at the individual factors. Drug binding to plasma proteins, how does this influence? The major transport proteins in the blood will be alpha-1 acid glycoproteins and albumin. We also have other proteins in blood like the glycoproteins, also called immunoglobulins. We also have fibrinogen, which is important for blood clotting or hemostasis. In this case, we are talking about albumin and alpha-1 acid glycoproteins. So the alpha-1 acid glycoproteins binds basic drugs, and the albumin binds acidic drugs like aspirin. So a drug that is bound to plasma proteins will be inactive, cannot produce pharmacological effect, and also cannot diffuse and be able to cross biological membranes because it becomes a larger molecule, and also cannot be metabolized or excreted. So it is so inactive. The other principle then means that the free drug is the one that is active and produce pharmacological effect, will be able to pass into other tissue compartments, can be metabolized and excreted. Now, these two forms, the free and the bound drug, exist in what? In a balance. In a balance where the dynamic